Now, for more on this development, let's speak with the chairman of the Nigerian Medical Association, Dr. Benjamin Olowojebutu. Good to have you join us.
Good afternoon. How are you today?
I'm doing well. I saw that you were present at the protest. So talk to us about what exactly is going on. 12 months of delayed salary for Lagos University Teaching Hospital staff. What exactly is going on, and what are you hearing concerning the situation?
So it's not all the staff. It's some of the staff that came in from other universities to complete their residency training.
Resident doctors, yes.
Yes, resident doctors to complete their residency training in LUTH, because they transfer from they're getting salaries in their former place of work, but now when they got to LUTH, they've not been able to migrate them into the LUTH IPPIS. That's what's going on. So they've been trying to write to the head of service for a long time to get this sorted, but every month goes and month comes, no salary. So it's been 12 months that has happened. So they needed me to help us NMA as a parent body to help them appeal to the head of service to let this thing just get so let them migrate them quickly and get their salaries and their arrears as soon as possible, because working for 12 months without getting paid reduces the quality of work, reduces the quality of life, increase their mental stress, and they can break down. So I'm glad to support them as a parent body that please, head of service, let us get this thing sorted. Let these young people get their salaries and let our life just improve. Thank you.
And I want to look at this broadly, because I know that this is just the Lagos University Teaching Hospital, that's LUTH resident doctors who came from other federal university hospitals rather. But this is also a larger problem, because there was a report recently that talked about how many Nigerian doctors, especially resident doctors, that have left the country in droves, in thousands. And when you go to the hospitals today, I think you for me, I'm speaking personally, I have only seen student doctors in the last 1 year, and not even resident doctors. It shows you how bad the situation is. What is the NMA as a body doing in terms of improving the welfare of doctors in the country?
So thank you very much. I think one of the leading causes of brain drain in our country is issues of welfare. Our welfare doesn't only talk about salaries alone. You can see our doctors getting kidnapped. You see doctors having low security issues. I think it's a systemic failure of the economy, of the government, that we've not put our right pegs in places. For example, how can somebody be working for a long time, 12 months, no salary? They're not happy to work, and it's easier for them to be poached by UK, by the US, because they tell them, they give them all the kind of luxury they need, and they can go. So it has increased brain drain. Last month alone, we lost over 200 doctors from Nigeria to the UK, and that's reducing the cost of it. So normally, WHO says is one doctor to 100 patients. Now we have one doctor to 600,000 patients, and it's reducing by the day. I think government should be deliberate about this and make it a national emergency on how to improve the welfare of doctors in Nigeria and make them stay back in Nigeria and give back. Imagine now, even before it was only the resident doctor and younger doctors that are leaving. Now the senior doctor, the consultants are also leaving. Who will not train the doctors coming? Who will not train the doctors are available now? So it's my appeal to government that we should have what we call a national emergency on health, so that we have practical solution in retaining our product. You know why? Because training doctors in Nigeria is far less than training doctors in the US or in America. So what the Americans and the British have done is that they will take our doctors, because they can't train enough doctors by themselves. They take our good doctors and use them for the economy. So our government must be very deliberate about improving welfare of the doctors, housing scheme, welfare scheme, security scholarships, training fees.
It seems like, it seems not as easy anyway, but it seems a bit easier now. But I think in the next 5 to 10 years, we'll see how the difficulty in human capital in the country, especially in the health sector. And that's why I was asking you earlier what the NMA is doing. Is there any negotiation ongoing for this particular situation in LUTH, and then just generally for doctors?
So generally, last 2 weeks, the hazard allowance that was promised by by the federal government was they started paying it, and they paid 4 months arrears. Even though the money is very very meager, at least it's something for the household allowance. So we're engaging government on improved welfare. We're engaging government on improved salary scales. We're engaging government on improved housing allowance, car loan allowance, so that people can be happy to stay in Nigeria and work in Nigeria, and be happy to work. You can drive your car in your house. You can drive your car in the night and not get scared about getting kidnapped. You heard about one of our doctors that died in Enugu just about 3 weeks ago, that was killed by terrorists on the road, and it's a doctor. He's senior registrar in family medicine, just died like that. So people are even afraid of other things, not just the salary alone, the economy, the fact that people are very averse to doctors improving, and we all buy things from the same market, and the value of our funding is very very reduced. So as NMA, we are engaging government, obviously, and we have appealed to the head of service. We have written a letter to our
and we will see how. We will see how, sorry to interrupt you, but we do have to go. We'll see how things play out, especially also for this situation in LUTH. We'll continue to engage with you to see how, just to know, get the update on whether they have been paid their salaries or not. Thank you so much for talking to us. Chairman of the Nigerian Medical Association, Lagos State Chapter, Dr. Benjamin Olowojebutu.